Depression is common among people who've just recently been diagnosed with HIV for a number of reasons. One of the reasons is that the diagnosis itself is life-altering, and so people will feel very down from knowing that they have to now change the way that they're living, that they have to take medications for the rest of their life, that they have to share their status with their new partners. And so we often see depression in our HIV population. We often see depression in our non-HIV population. It's just that HIV adds, again, that additional layer that does need some extra focus. Mental health support for people with HIV is such a blessing, and in many HIV practices, what you will find is you'll find doctors like me that will treat your HIV, and you'll also find psychiatrists or psychotherapists who will work with you on any degree of mental health issues that may come up. And that's because HIV is the kind of disease that, yes, you can take the medications, but you also have to treat the kind of reality of what it means to have HIV. So I think one of the most important things you can do once you have HIV, if you get that diagnosis, is to just talk to someone and just make sure that you're getting support from all angles, in addition to taking your antiretrovirals. Many clinics will actually offer support groups within the clinic, or you can go online and find local chapters for HIV survivors who, are just kind of working together to keep each other supported. And I have found that if I'm able to refer some of my patients who are having a hard time accepting and understanding the diagnosis, the difference in them just feeling like there's hope is something that I can see after they've gone to even one meeting. The model and the idea, though, is that you shouldn't be someone who has HIV and be on your own. You should find an environment that allows you to feel supported from the medical perspective, the mental health perspective, and then the peer-to-peer perspective as well. So if you have HIV and you have very severe depression or you have thoughts of suicide, that is considered a medical emergency. So it's really important that you either go to the emergency room and you let them know that you're having thoughts of suicide, or call the suicide hotline, or when you come into your primary care doctor, let them know. The most important thing in general with depression, I would say, even though it seems kind of opposite to what you want to do, is to tell someone about it and to get the help that you need.